But come on, doctor, you are telling this field is evolving, the field is innovating, but do you really need the patient-specific instrumentation? Do you really need navigation? Do you really need all these technology? Or is it all you're trying to sell a magic dose or a magic key and trying to sell the magic key as a key to every single thing or every single pathology in orthopedics? Or like, are you just trying to market the innovation, or is it true? Then there comes the question, with all this technology, if there is no orthopedic injury happening in this world, if there is no sports injury happening in this world, if there is no spine injury happening in this world, if there is no degeneration happening in this world, then all this innovation and invention would go irrelevant. So you need to be relevant, right? So what is the disease burden? So the science is evolving, but what about the disease burden? Do we have a real burden of degenerative disease and spine problems and other things in the field in this world? Look into this paper. See, like if you are going and sitting in any orthopedic OPD, the predominant number of patients are presenting to you with a lower back pain, tendinopathy, arthritis, soft tissue injuries. Many people would say orthopedician is just going to operate on a fracture and to treat their deformities. No, the most common complaint to an orthopedic OPD is not a fracture, it's a lower back pain, tendinopathies, arthritis, and soft tissue injuries. I'm telling, there are heaps of policies in countries like India and also in the developed countries where I'm working, like to control the road traffic accidents, the land accidents, and things like that. But what is the policy in place to prevent a lower back pain? Is there any policy in this world available to prevent aging, to prevent degeneration, to prevent arthritis? Rather, the population is getting gray in the developed countries, and also in southern part of India, the population is getting gray. So the number of people who are going to be affected with arthritis and degenerative disease is more. And you can't tell a 70-year-old lady, come on, you are aged, just sit at home, you can't do anything. Like you ripping their abilities and function of their ability to move or their mobility is like you ripping their freedom, right? Just because they are old, we can't rip their freedom. So every arthritic patient may need some kind of an orthopedic assessment and management to come out and function as normal as they were 20 years back, right? So if we can do that by surgery or orthobiologics, then we would still be relevant. And that's what I'm talking about. The science is evolving, and at the same time, the burden is increasing as well. And no wonder the science would evolve with the burden. It's always a demand supply thing. And trauma is much less. Where is trauma here? After like heaps of other complaints, trauma comes here, right? So I would say the degenerative medicine is the component in orthopedics is evolving much more, and the tip of the iceberg. It's what you think about orthopedics is just the tip of the iceberg, and you have a lot more other stuff buried underneath. So explore the field. It is a good specialty to subspecialize in. And look into the spine injury. So the land transport, like look at South Asia, the falls are increasing, but in 10 years or 20 years, we would be a developed countries, right? And in that case, then the land transport related problems would increase, the sports related injuries. Now in India, you can see only like 1% of spine injuries are from sports, but countries like Australia, countries like America is having close to like 10% of spine injuries from sports and recreational activity. And India is not going to be far away from similar kind of scenario in future. So sports injuries are in rise, and it is a good subspecialty to work on. And think of degenerative disease and look into the annual incidence, guys. See, India is looking green in this, but I'm telling that is because of underreporting of the disease and the degenerative changes. And whenever there is a degenerative changes in a 60 or 70-year-old lady with a spine problem, we would say, take rest. Come on, you don't need a spine surgery. So we don't report the incidence, and that's why we are looking green. This doesn't mean we are truly green. Okay, and also the average number of years an Indian surviving is much less than an American and an Australian and people of a first world country. So the possibility of them developing the degeneration itself is less because of their lower, life expectancy. And this is another chart showing that, how because of the spine injury, a person's activity of daily living and their productive living is affected. And, sorry for the bad terminology. So this says a bone cancer treatment market. I would say a bone cancer treatment burden, right? So that is the right word. If you see India, even America and India, both are having a bone cancer. The prevalence is very high, and the availability of surgery to such patient with bone cancer is very less, right? So the number of orthopedic bone tumor surgeons in the country is very, very less than what you are thinking. So the cancer treatment is not neither. It's very expensive, number one. And when you can bring this expense of the cancer treatment of bone down, only when you get more doctors on the specialty and more research happening here, thereby we can get a more affordable kind of treatment. Thereby more people would have access to these kind of surgeries. And look into the share of population without access to surgery. India is in like a dark, right? Close more than 80% of the population who may actually need a surgery are not getting the surgery done, right? Why? Because we assume surgery is not needed, especially when there is a physical problem happening, mechanical problem running in the patient, like deformities and degeneration and arthritis and things happening, and you just assume it is what it is. You just accept it. Okay, I agree, acceptance is good, but not at the cost of your freedom and your mobility, I would say. Look into countries like US and the Scandinavian countries, all these Europe and several part of Europe, the access to surgery is close to 100%. It's close to 100%, right? But in our country, the access to surgery is very, very limited.